There's a quiet myth in modern medicine, one that says the more you check, the safer you are. More tests, more scans, more screens. But what if after 70, some of those routine checkups aren't protecting you? They're silently putting you at risk. Namaste, dear friend. I want you to pause and think about this. What if the very procedures designed to catch disease early were now quietly disrupting your body's balance, your peace of mind, and even your independence? You've spent decades caring for your health, watching what you eat, staying active, listening to your body. But no one told you that aging changes the rules. That after 70, some checkups carry more danger than benefit. That prevention can turn into overdiagnosis. That a well-meaning test could lead to surgeries, medications, and complications you never needed. This isn't about fear. It's about clarity, about reclaiming your power in a system that often assumes more is always better. In this video, we're going to shine a gentle but honest light on 5 common health checkups seniors are often pushed toward without being told the full story. You'll learn which tests you can question, which ones to decline, and why sometimes. Doing less is actually the wiser path to health, so stay with me, because what you discover today could change how you approach every future doctor's visit. Some warnings arrive dressed in white coats and charts, quiet, clinical, and confident. The DEXA scan is one of them. It looks simple, a scan to see how strong your bones are. No pain, no fuss. But what most seniors don't realize is that this innocent-looking test can quietly open the door to a lifetime of unnecessary drugs and side effects. You see, after 70, many people are told their bones are too thin, even when they've never had a single fracture. That label, osteopenia or osteoporosis, can sound frightening. Suddenly, the conversation shifts from monitoring to medicating. Doctors reach for a prescription pad, and drugs like bisphosphonates or hormone treatments become the new normal, all to protect your bones. But here's where the dilemma begins. These medications don't come without a cost. They've been linked to brittle bones, spontaneous fractures, and in some cases a rare but devastating condition, jawbone decay. Yes, the very drugs meant to prevent breaks can ironically weaken the body in other dangerous ways. And here's what's rarely said aloud. Many of the bone loss diagnoses from DEXA scans are based on comparisons to 30-year-old bones. So of course a 75-year-old body shows some difference. That's not disease. That's aging. That's life. True health after 70 means preserving strength, mobility, and confidence. Not chasing shadows on a scan. Gentle strength training, calcium through food, vitamin D from sunlight, walking in nature. These habits protect your bones naturally. They nourish your whole body, not just a number on a machine. So before you let a scan define your future, ask the real question. Are you being treated for a disease or for a number that never needed fixing? Because sometimes the most powerful medicine is wisdom. It begins with a quiet suggestion at your checkup. Let's just run a PSA test to be safe. One small blood draw. No harm done, right? But behind that simple test lies a complex web of consequences that too few seniors are warned about, until it's too late. For men over 70, the PSA test, meant to screen for prostate cancer, can quickly become a trap. A slightly elevated number on the result sheet is often all it takes to set off a chain reaction. More tests, more scans, and eventually a biopsy. And even if the biopsy finds something, that something is often a harmless, slow-growing form of prostate cancer that would never have caused pain, symptoms, or problems in the years ahead. Yet the fear it triggers is anything but harmless. This is the PSA confusion. where well-meaning prevention quietly shifts into unnecessary treatment. Many seniors end up undergoing surgery, radiation, or hormone therapy for cancers that were never destined to hurt them. And those treatments? They come with very real side effects: incontinence, sexual dysfunction, fatigue, and emotional strain. The tragedy is this: most men in their 70s and 80s with slow-growing prostate cancer are far more likely to die with it than from it. But once the diagnosis is made, walking away becomes difficult. Fear clouds judgment. Doctors act quickly, and what began as a routine blood test can cost you far more than peace of mind. It can cost you your quality of life. So the real question becomes, is the PSA test protecting you or pushing you into a journey you never needed to take? For healthy men without symptoms, many geriatric specialists now advise skipping the PSA altogether, not as a sign of neglect, but as an act of wisdom. Because in the later chapters of life, thoughtful restraint can be more powerful than aggressive intervention. And sometimes, the strongest choice is saying no. It begins with a simple blood test. You feel fine, maybe a little tired, maybe a bit slower than before, but nothing alarming. Then the phone call. Your thyroid numbers are off, they say. And just like that, you're holding a prescription that could change the rest of your life. But here's the truth. Few doctors explain clearly. As we age, our bodies naturally shift. Metabolism slows, hormone levels adjust, and the thyroid, the small butterfly-shaped gland in your neck, often reflects those changes in ways that aren't dangerous at all. A mildly underactive thyroid in someone over 70 is often just part of the aging process, not a crisis. Yet, many seniors are placed on lifelong thyroid medication for numbers that would have been considered borderline or even acceptable at an earlier age. This is where the trap lies. The pursuit of perfect lab results can sometimes come at the cost of real-world well-being. Once medication begins, your body may respond in unexpected ways. Irregular heartbeat, increased anxiety, sweating, restlessness, or even new bouts of depression. You begin to treat a lab report, not a person. Mr. Suresh, 76, was vibrant and sharp. A routine test showed his thyroid was low normal. He started on medication. Within weeks, his sleep was broken, his heart raced at night, and he felt a strange nervousness he hadn't known before. It took months to adjust. And for what? Numbers on paper that meant very little for his actual health. The wiser approach, especially after 70, is to ask not just, what do the numbers say, but how do I feel? Are you fatigued in a way that disrupts life? Are your moods shifting without explanation? Are there real symptoms to support intervention? Because sometimes, the best medicine isn't another pill, it's restraint. It's understanding that treating the person matters more than correcting a chart. Every picture tells a story, but after 70, not every story is worth chasing. You feel a little stiffness in your knee, maybe a dull ache in your lower back, nothing unbearable. But during your next visit, the doctor orders a quick X-ray, just to see. You nod. It sounds harmless, fast, painless, routine. And then the report comes back. Degenerative disc disease, mild osteoarthritis, bone spurs, narrowing joints. The words sound heavy, clinical, frightening. But here's the truth most people don't hear. Those findings, they're normal, they're expected, they're part of aging, just like gray hair or wrinkles. But when we put them on a screen and give them big names, they suddenly feel like problems that need fixing. And that's where the spiral begins. One X-ray becomes a referral becomes an MRI, then maybe injections, a surgery consult, physical therapy, medications with side effects. All this for something that wasn't even hurting you before the scan. You see, the danger isn't in the machine. It's in what we do with the story it tells. Modern imaging is so sensitive that it picks up everything, even harmless changes that millions of seniors walk around with every day, perfectly fine. But we're trained to react, to fix, to intervene. And often, those interventions don't lead to less pain. They lead to more stress, more appointments, more time spent treating images instead of honoring how you actually feel. This isn't about ignoring pain. It's about choosing care that fits your body, your age, your goals. If you're not in severe pain, if your movement isn't impaired, then maybe the best response isn't another scan. It's patience, gentle movement, and trust in your body's natural rhythm. Because sometimes the wisest medicine is letting your story unfold without unnecessary edits from the X-ray machine. They say knowledge is power, but sometimes knowing too soon can become a silent burden, especially when it comes to your mind. Picture this. You're sitting across from a doctor, answering a list of questions. What day is it? Who's the president? Can you remember these 3 words? You hesitate. Not because you've forgotten, but because you're nervous, your heart is racing, and now you're under a microscope. The result? A mild concern, a vague score, a new label, and suddenly your mind, once curious, sharp, and full of memories, feels like it's under suspicion. Memory screenings in seniors without symptoms often start with good intentions. Doctors want to catch things early. Families want peace of mind. But when there's no treatment that truly reverses dementia, and when no real concerns were even raised to begin with, what are we actually accomplishing? For many elders, the answer is silent harm. A premature diagnosis can create a storm of unnecessary anxiety, the fear of losing control, the weight of being watched, even normal forgetfulness, like misplacing your glasses or walking into a room and forgetting why, suddenly feels dangerous. Every slip becomes magnified. And ironically, this fear-driven tension can worsen memory. Even worse, once a label is attached, it's hard to shake. It follows you in medical charts, family conversations, and even how people treat you, all based on a screening that, in truth, tells us very little without clear symptoms. This isn't about denying the reality of cognitive decline. It's about respecting the mind's natural rhythm. Slower recall, occasional forgetfulness. These can be a normal part of aging, not a cause for alarm. So before you agree to a screening you didn't ask for, pause. Ask yourself, am I truly worried about my memory? Or am I being tested just in case? Sometimes the most respectful thing we can do for our minds is to trust them until they tell us otherwise. Because the truth is, aging isn't a disease. It's a season of life that calls for wisdom, not worry. And while the world around you may rush to poke, prod, and scan every corner of your body, you to know, not every test is a gift. Some are doorways to stress, confusion, and treatments that take more than they give. After 70, the question isn't, what more should I check? It's, what truly supports the life I want to live? A calm heart, a clear mind, a body that moves with grace, a routine that honors rest, not interruptions. These aren't found through machines. They're found through mindful choices, through listening to your body, trusting your experience, and saying no when your instincts whisper that something feels unnecessary. So the next time you're offered a scan, a test, or a prescription just to be safe, pause, breathe, ask the deeper question, will this help me live better, or just worry more? You are not fragile. You are seasoned. You are wise enough to choose care that fits your age, your goals, and your values, not care that blindly follows protocol. If this message resonated with you, share your thoughts in the comments. Tell us, what's one thing you'll do differently after watching this? Your story may just be the voice someone else needed to hear. And if this video gave you clarity, subscribe and join us on this journey. Together, we're not just growing older, we're growing wiser.